Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Blood thinners. What you should know. Blood thinners is a common term for anticoagulation medications used to treat and prevent blood clots. They do not thin the blood but instead block certain clotting proteins. /r/n/r/n blood travels through blood vessels in a liquid form to bring oxygen and nutrients to tissues throughout the body. When blood clots form in the body, they block normal blood flow from reaching tissues and can cause tissue death, such as in heart attack, stroke, and pulmonary embolism. /r/n/r/n While anticoagulation medications can be life-saving, they carry a risk of bleeding. This article discusses the types of blood thinners, their medical uses, and side effects. /r/n/r/n Grill Getty Imagesrnrn Blood thinners are anticoagulation medications that treat and prevent blood clots. Blood clots are semisolid clumps of red blood cells, platelets, fibrin, a type of protein, and other proteins. /r/n/r/n Blood clotting is an extremely important function of the body that prevents bleeding. Without blood clotting, a small cut would cause serious, prolonged bleeding. /r/n/r/n Another word for blood clot is thrombus, but when a blood clot travels to another place in the body, it is known as embolus. For example, a pulmonary embolism is a blood clot that has traveled from the deep veins in the leg to the arteries in the lung. /r/n/r/n Blood clots form through two important processes, the coagulation cascade and platelet activation. Blood thinners work by targeting steps in each of these processes. /r/n/r/n In the coagulation cascade, damaged tissue sets off a cascade of events that activates several proteins in the blood, called clotting factors. These proteins are activated through a series of steps that, ultimately, activates fibrin. Fibrin is a protein formed during the clotting process that helps stop blood flow. /r/n/r/n Another important part of blood clots is platelets. Damaged tissue activates platelets in the blood. Activated platelets attract other platelets, and they stick to each other to plug up the wound and stop the bleeding. /r/n/r/n Blood clots rich in red blood cells and fibrins are known as red clots, whereas those rich in platelets, which are colorless, are referred to as white clots. Red clots are found in veins, like the leg veins, whereas white clots are found more in arteries, like the coronary arteries of the heart. The distinction of red versus white is based on the color and composition of the clots, but all clots contain varying amounts of platelets, fibrin, and red blood cells. /r/n/r/n In a broad sense, blood thinners are used to treat blood clots or prevent blood clots from forming when they are dangerous to the body. The following are some specific conditions that could require blood thinners. /r/n/r/n In general, all anticoagulation medications work by either blocking or inactivating part of the system that forms blood clots. These medications work by binding to proteins that are involved in either the coagulation cascade or to proteins on platelet surfaces. /r/n/r/n Anticoagulant medications target the coagulation cascade, whereas antiplatelet medications target platelet activation. These medications can be oral pills or injections. /r/n/r/n Anticoagulant blood thinners target various proteins in the coagulation cascade. These medications are used for treating red clots, like deep vein thrombosis and pulmonary embolism, as well as preventing strokes in atrial fibrillation and mechanical heart valves. /r/n/r/n Anticoagulants are also used during acute blood clotting in arteries, such as heart attacks, acute limb ischemia, and acute mesenteric ischemia. Examples of anticoagulants include /r/n/r/n Antiplatelets are medications that target the activation and aggregation of platelets. They are commonly used in the treatment and prevention of stroke and heart attacks. /r/n/r/n antiplatelets are also used to protect stents placed in the heart's coronary arteries and other arteries, such as carotid arteries of the neck and leg arteries in peripheral arterial disease. /r/n/r/n examples of antiplatelets include /r/n/r/n. Unsurprisingly, the main side effect of blood thinners is bleeding. People who take blood thinners will notice that a cut or nick takes longer to stop bleeding and that they bruise more easily. But serious bleeding, such as bleeding in the gastrointestinal tract or brain, can occur. These bleeds can be life-threatening. /r/n/r/n It is important to avoid contact sports or activities while taking anticoagulation. /r/n/r/n Each specific drug has a list of side effects that can range from nausea, constipation, and headache, to shortness of breath and severe allergic reaction. /r/n/r/n Some foods and supplements are believed to have some blood-thinning properties. However, they are not regulated by the Food and Drug Administration, FDA, and the concentration of active compounds in supplements is not consistent. /r/n/r/n Always discuss any supplements you're taking or considering with your healthcare provider, as they can interfere with other medications. Supplements should never be taken as a replacement for a prescribed blood-thinning medication. /r/n/r/n The following have some evidence of blood-thinning properties. /r/n/r/n Blood thinners are important medications used for treating and preventing blood clots. These include anticoagulant and antiplatelet medications. The benefit of taking blood-thinning medications must always be weighed against their risk of serious bleeding. /r/n/r/n If you have been prescribed a blood thinner, it's important to pay attention to signs of bleeding, like red or black-colored stool, severe headache, lightheadedness, and fainting. If you notice any of these symptoms, seek medical attention right away. Also be sure to discuss any supplements you're taking with your healthcare provider, since many of them can affect how your medications work. /r/n/r/n This depends on the type of blood thinner, and can range from hours to days. The blood-thinning effects of warfarin, aspirin, and Plavix, clopidogrel, can last for days, whereas Eliquis, apixaban, and Xarelto, rivaroxaban, wear off in about a day. Lovenox, low molecular weight heparin, wears off after about 12 hours. /r/n/r/n This depends on why your healthcare provider prescribed a blood thinner in the first place. After a heart attack or ischemic stroke, most people can expect to be on at least one blood thinner for life. People who take blood thinners to treat provoked deep vein thrombosis may only need to take them for 3 months. /r/n/r/n said, non-steroidal anti-inflammatory drug, pain relievers such as Advil and Motrin, ibuprofen, and Aleve, naproxen, have blood-thinning properties and should not be combined with blood thinners. This is especially true of aspirin, since these other NSAIDs can compete with the same binding site that aspirin uses and make aspirin ineffective. /r/n/r/n Tylenol, acetaminophen, is generally a safe over-the-counter pain medication to take while on blood thinners. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.